So how are midwives different from OBGYNs? Well, midwives are trained and skilled and have a lot of education in normal birth and normal healthy women. So as long as you are having a normal healthy pregnancy, a midwife could be a really good option for your provider of care. Now, OBGYNs are surgeons and they are doctors who have been trained in the complications that happen with health, and they do happen. So midwives and doctors work really well together. For healthy pregnancies, midwives provide excellent care. And then if your pregnancy were to become complicated, that's when an OBGYN can step in and really use their skills to the best of their ability. So to tell you about why midwives are so great, I thought I would read you a couple quotes about midwives. So these two are from doctors who were actually, both of them at different times, were the president of the American College of Obstetrician and Gynecologists. The first one is from Richard Waldman. He says, OBGYNs working collaboratively with midwives are a way to address the gap between the supply of OBGYNs and the demand for women's healthcare services. So that's good. As we said, OBGYNs and midwives working together. Perfect solution. Doug Lobb, also a doctor, says midwives offer evidence-based healthcare services. In today's world of high technology, midwifery services provide the individualized care that women need, which is also awesome. A couple other quotes come from, actually, I'm not sure who said this, but I think it's pretty amazing. It was a midwife. She said, birth is not just about making babies. Birth is also about making mothers. Strong, competent, capable mothers who trust themselves and know their inner strength. And I think that really says what midwifery is all about. So in addition to all the great things that are being said about midwives, the ACNM, the American College of Nurse Midwives, has put together a ton of research that shows that over the last decades, people who have used certified nurse midwives have lower rates of cesarean sections. They also have lower rates of induction of birth and augmentation, meaning that they use medications to kind of push birth forward, that they have a significant reduction in really bad perineal tears as the baby comes out. They use less anesthesia, and they have higher rates of breastfeeding, which is really good for the health of both the baby and the mom. It also has shown that midwives provide really good prenatal education as far as increasing health behaviors and decreasing risky health behaviors, and that midwives have a more hands-on approach than most OBGYNs do, so that it facilitates a closer relationship between mothers and their midwives. Also, midwives, when midwives are used, there are less technological interventions, which is really awesome. So people who have and use midwives have a higher chance at having a normal vaginal birth and successful breastfeeding. You're also more likely to have care provided by your midwife throughout your labor, which is really wonderful. And you have an increased sense of control during the labor and birth experience. Overall, women who have had CNMs instead of OBGYNs have had higher rates of breastfeeding. They feel more prepared for labor and birth. They have better prenatal knowledge, and they are more satisfied with their care. And again, all of that information is from the American College of Nurse Midwives, and I have a link to their packet of information down below. So I also want to talk to you a little bit about birth centers. What exactly are birth centers? Well, birth centers are places with a home-like environment for labor support, birth care, and as well as prenatal and postpartum care. They are centers that are focused on cost effectiveness, safety, and a good birth experience. Birth centers emphasize the midwifery model of care, meaning that they consider birth to be a part of normal life, albeit a very exciting and special part. They emphasize one-on-one interaction with your labor support, as well as extensive prenatal education. They want you to be involved in your labor preparedness, in your prenatal care, and in your labor, so that you are the expert on your own pregnancy and your own birth. Birth centers often are also really good community resources. They'll often hold prenatal classes, have support groups for pregnant women or for lactation. Often they have libraries with DVDs and books for you to check out and read or check out by yourself. And they can be an excellent community resource. They also do a really good job at balancing technology and modern medicine with holistic and personalized care. A big concern about birth centers is, are they safe? But studies have shown, including a big extensive study that was done in America called the National Birth Center Study, that birth centers really do a good job at providing excellent care for low-risk pregnancies. They do it in a cost-effective way and a way with very few interventions and very, very high safety standards. In addition, most people who have births at birth centers are very, very satisfied with their care and the experience that they had with their birth. Now, of course, it's really important to make sure that you choose a safe birth center. You want one that is accredited by the American Association of Birth Centers, and you want to make sure that you ask about how many people are going to be attending your birth, at least 2, and make sure that they are certified in newborn resuscitation, CPR, and that you ask questions and make sure that you are comfortable with any birth center that you would choose to give birth at. Now, one part of a birth center that is really important to talk about, I think, is the pain management, because that's something that a lot of women feel that they really want to have good control over. Now, a lot of people are really nervous or don't think that they could give birth without an epidural or without pain medication, but I want to tell you that you absolutely can if that is something that you want to do. Women have been doing it forever and ever and ever, and I see every day at my job the strength of women, both that have epidurals and that don't. Your body was made to do this, and you absolutely can. Now, if you choose to deliver at a birth center, or if you want to, you can get pain management classes, and you can get the education that you need to manage the pain of labor without medication. If that is something that you want to do, you absolutely can do it, and it's not something that you need to be afraid of. So now that we've talked about midwives and we've talked about birth centers, I want you to understand why it is so important that you know this stuff. And this is so important because you have options. You have the option to choose who you want to take care of you, and you have the option to choose where you want to give birth when and if you get pregnant. Now, the absolute most important thing for you to think about when you are choosing your care provider is that you choose someone who makes you feel comfortable and makes you feel safe. Now, whether that be an OBGYN or a midwife or a nurse practitioner, there are options for you. There are options for where you want to deliver your baby, in a hospital, at home, or in a birth center. And again, the most important thing is for you to feel comfortable and you to feel safe. Now, there are a lot of things that you need to think about. For instance, if you desire a natural childbirth, if having a vaginal birth is really important to you, if having a birth without medication is really important to you, if breastfeeding is really important to you, these are things that you need to ask your care provider about, be it a midwife or an OBGYN. You want to ask them what their rates of C-sections are, and talk to them about what they could do to make sure that you're not going to get intervention that you don't want or that you don't need. To help you out, I also have posted a link at www.delivermybaby.org. They have an excellent quiz that if you just take a couple minutes to take, it'll help you guide your decision about about what kind of care provider would be most in alignment with your values. I want to emphasize here that there is no right or wrong answer about who the best provider of care is. The only real question is, who is the best provider of care for you? And that is someone who you feel comfortable with and who you trust to make decisions that are based on your well-being. So I think that's all I have for you. Thank you so much for watching my video. I really, really appreciate it. And below me, I have a lot more links. I have information for you, more videos about midwives and information about midwives and birth centers for you. I have that quiz to help you decide like who might be the best provider of care for you, and the midwifery hallmarks of care, as well as the midwifery philosophy of care. So please check out that information. I also have all my references down there, so you can check those out if you would like to. Now I have a couple surveys posted, one for RNs, one for doctors, one for hospital administrators, and one for women in the community who you're going to need a provider of care at some point. So if you would please, please, please fill out one of those surveys for me, I would really appreciate it. Again, thank you so much for watching my video and taking the time to learn about midwives and birth centers and about your options. Peace and love to all of you. Bye.